Hello, and welcome to your Plan Year 2020-2021 Open Enrollment presentation. My name is Janelle. I'll be your presenter today. We'll be reviewing benefits for the upcoming plan year. Your open enrollment period for the upcoming plan year will be from February 10th to February 21st. We want to say welcome to the employees of St. Leo. We are so pleased that you're one of our 27 member schools. Cuba has been celebrating 18 years of service to private Florida education employees. Here is a sneak peek of what we'll be reviewing with you today. What's new for April 2020. There on the right-hand side of your screen. We have a low increase in the medical premiums. We'll review the new group Aflac benefits with you, Rally program enhancements, your new medical plan offerings, the increase to the flexible spending limits, dependent verification, and the phone number and email confirmation prize. On the left-hand side of the screen, we'll review some of the same great benefits that you currently have. With that being said, we'll move on into the presentation. ICUBA is a self-funded plan. So that means that ICUBA pays all claims processed by the medical, pharmacy, and behavioral health benefit managers from premiums collected and reserves built up over the years. ICUBA keeps all premium dollars saved for the exclusive benefit of our members. We only spend premium dollars on our members. The plans are created specifically by educators for educators, and we truly believe in investing in a long-term culture of well-being so you can be the best version of yourself. And so we are pleased that because you have been such savvy consumers that we're able to bring you this low premium increase for the 2020-2021 plan year. New are the group Aflac benefits. So we're pleased to offer these to you, including the critical illness, the high and low hospital indemnity, and the accident plans. These new group plans will provide better benefits at a lower cost in most cases. Guaranteed issue will be offered during open enrollment, which means no medical questions will be asked. If you do have any prior Aflac plans, those will no longer be offered for a payroll deduction. Portability information was mailed to you if you'd like to keep your current plan. So first, we have the Aflac Critical Illness Plan. This includes coverage for cancer, heart attack, sudden cardiac arrest, coronary artery bypass, major organ transplant, bone marrow transplant, kidney failure, and strokes. Some of the features of the plan is that it pays a lump sum cash benefit to you. It pays in addition to other insurance carriers. It's guaranteed issue, up to $30,000 of coverage for the employee and up to $15,000 for a spouse. A spouse selection, keep in mind, cannot exceed 50% of the employee election. One of the great features of this plan is that children are automatically covered up to age 26 with an employee election, so you don't have to make a separate election for your children. You can take this coverage with you if you change jobs or retire, and we hope that no one experiences one of these covered critical illnesses. That's the plan for everyone. So if you don't need to make a claim on this benefit, you do have that $50 annual health screening that you can still apply for. Next is the hospital indemnity plan. This plan covers hospital admissions and confinements due to an accident or illness. Some of the features is that it pays a lump sum cash benefit to you. It pays in addition to your other insurance coverage. Again, you can take this with you if you change jobs or retire. You can have your premiums deducted right from your paycheck, and it's guaranteed issue, so no medical questions will be asked. There are two levels of coverage being offered, a high and a low. Under the high plan, an admission pays $1,000, and both the confinement and intensive care pays $100. Under the low plan, admission is $500, and again, both confinement and intensive care pay at $100. We did want to include an example here for the hospital indemnity. We use the example of a pregnancy or delivery. Under the high plan, the admission you get paid $1,000 for your admission. If you're confined for 3 days, that's an additional $300. for a total payment to you under the high plan of $1,300. And then under the low plan, the admission, you would get $500. And then for a 3-day confinement, that's $100 per day for $300 for a total payment to you of $800. And then lastly is the group accident plan under Aflac. No one ever plans for an accident, so when they happen, we're all hoping and praying that our finances can handle it. But with this new group accident benefit, you do have some coverage for your, you have some example benefits here on the screen for your ER, urgent care, ambulance, concussion, lacerations, fractures, dismemberment, your 2nd and 3rd degree burns. These are all benefits that are covered under this accident plan. And again, if you don't need to use this benefit, like the critical illness, that $50 health screening benefit does still apply, and you can cash in for that as well. Next, we just wanted to go over some of the 2020-2021, that's a mouthful, Rally program enhancements. The Rally survey for this upcoming plan year is still the gatekeeper, so you still must complete that survey before you'll see or have access to any of your Rally dollars. But the enhancements for this year comes in on the wellness exams, your biometric screenings, and your on-site events. For that wellness exam for this next plan year, you're getting $60. That's up from $25. The biometric screenings, you're getting $40. Again, that's up from $25. And then for your on-site and campus events, last year, you could earn up to $50 for 5 events. This year, we're bumping that up to 7 events, $10 each, so you have an opportunity to earn $70 there. For your PSAs, colonoscopies, and mammograms, those are still $50 rewarded for the first claim process. You still have an opportunity to get $50 for a medication change through our Cuba Cares. We will still have our missions and city challenges. Those, you can earn unlimited coins for those, and we do still have the iCuba private sweepstakes. There's Tenet Doc and tobacco attestation. You'll get 400 rally coins for registering for Tenet Doc and 400 for the tobacco attestation program. We also still have the clinical rewards. You can earn 500 coins per quarter for 2,000 coins of the plan year. And then introducing the physician results form. This is new this year. No more finger pricks or additional blood draws. Starting April 1st, you have the opportunity to get credit for your biometric screenings just by visiting your doctor's office. So you can log on to the Quest portal at myquestforhealth.com. It's the same site you used if you scheduled an on-site patient center appointment. You go to the Quest portal and download this physician results form. One thing I warn you against is making copies of this form and giving them to your friends or your coworkers. This form will be specific to and tailored for you, the employee, or your spouse. And so you don't want to share this form. When you schedule for your annual wellness exam, you'll take this form with you. If your physician does blood work in his office, you will give this form to your doctor. He'll draw that blood and send it off to Quest. Once he receives the results back from Quest, he'll put it on this form and then send it off to the Quest portal, and you'll be awarded those $40. We do suggest that you get a copy of the form just for your own records. Plus, we know that those doctor's offices, that front office, sometimes they get a bit busy, so you don't want to leave it just in their hands. Get a copy for yourself. If they haven't submitted it or you think it's taking too long, you can always fax or upload it to the Quest portal yourself. And we have a few rally reminders. Again, the Clinical Rewards Program for Chronic Conditions. This program provides members who have these chronic conditions listed here on the screen with some additional educational materials and the opportunity to engage with a health coach. For participating and achieving your goals in this program, you're given 500 coins each quarter for a total of 2,000 coins per year. If you do qualify and you have one of these conditions, when you log into the Rally portal, it's automatically there for you. You'll see something with your chronic condition there with some coaching materials and a contact number for that health coach as well. On the left side, we still have the city challenges and private sweepstakes through iCuba. Every 2 weeks, we do a drawing. If you entered into one of the city challenges and you cross a milestone, You're automatically entered. We're not asking that you win the challenge, but just that you're participating, your smart device is synced. Every time you reach a milestone, you're entered. There's no limit or restrictions. You can be multiple entries. You can be a winner every 2 weeks if possible. So just keep those in mind. They're out there for you, and that's just an incentive, especially for those who are already walking, already working out. Make sure you're syncing your device so you're automatically entered to win those sweepstakes. Next, we just want to show you the value of this new rally program. On the right-hand side there, you'll see a picture of Emma. If you've ever gone through the open enrollment experience and you're familiar with Emma, we wanted to take her and use her example today. So this next example is where we hope Emma will be next year this time. So Emma has downloaded the Blue Cross and Blue Shield mobile app and was able to locate a BDTC provider, so all of her doctor's visits are free. She got an annual physical at her BDTC, and she earned $60. The primary care physician submitted that physician results form, earning her an additional $40. At work, Emma participated in 5 on-site events totaling $50, and she's hoping to do 2 more. During a recent doctor's appointment, Emma was diagnosed as diabetic. She connected with Blue Cross and Blue Shield health coach through the Rally Clinical Rewards program to help control her condition. So to date, Emma has earned, and of course this is next year, Emma has earned $150 Rally dollars and donated 8,000 coins to various Rally charities. What we really want to highlight here is that Emma hasn't really done anything out of the ordinary. She's gone to her doctor and she's attended and participated in a couple of events that were on campus, and she's already able to earn $150 and a ton of coins, 8,000 of which she's donated. So you don't really have to do much to participate and earn these Rally dollars. And if you qualify for a medication change or you get a PSA or a mammogram, you still have some additional opportunities to earn even more dollars. So you don't have to do much under this Rally program to really get engaged and earn those Rally dollars. Next is the new medical plan offering for the upcoming plan year. There's the $4,000, $8,000 deductible PPO medical plan. This plan offers freedom for families with children. This plan provides a premium cost savings for healthy families with children included. So if you're an employee only or you have employee and spouse coverage, this may not be the plan for you. But you get a freedom to choose the plan you want that meets you and your family's needs. You can shop and price for the services that you want, and you can visit any provider that's in network that you choose. The only difference really comes in at this plan. The deductible and out-of-pocket are significantly higher than the preferred PPO plan. Your co-insurance or your co-pays are much higher as well. While the premiums you pay on this plan are much less, if you experience a catastrophic event, this plan may end up costing you more. So this is why we specifically tailor it towards those healthy children and families only. Otherwise, this plan gives you the same great core benefits that don't apply to the deductible, those same great Rally well-being incentives, the same prescription drug coverage that you would always see with any of those 2 other plans that we already offer. We'll discuss the $4,000, $8,000 plan in a little detail in a couple slides later, but we do have a new medical plan offering for those families with children may want to consider. New flexible spending election required each year. Of course, for your flex spending, there's a mandatory election, an active election. You must go through open enrollment each year. So there's 2 flex plans. There's the healthcare and dependent care. For both of these plans, they're funded by you, the employee, through a pre-tax payroll deduction. On the healthcare FSA, the funds are available to you immediately April 1st. On the dependent care, it's a little different. The funds are deposited each paycheck. On the flex, the FSA, the healthcare, you're able to use it for your medical, dental, vision, and prescriptions for you and any of your eligible tax dependents, so they don't need to be enrolled in your medical insurance in order for you to participate and for you to use those funds for them. And then there is an increase by the IRS this year on the healthcare FSA. It's going up from $2,700 to $2,750 this year. So if you are an FSA participator, keep that new increase in mind. And then we'll switch over to the middle column to the dependent care. This account can be used for adult daycare and child care for your children up to the age of 13. And that's child care for daycare, after school, your summer camps, and then your gap care for any school holidays. The IRS calendar household limit for the dependent care is $5,000. And again, that's per household. These flex accounts are use it or lose it. Nothing carries over, so plan wisely as you're going through open enrollment. And then the last column, this is more of a review and FYI, because the HRA is paired with your medical plan. You don't need to actively make an HRA election. This is contributed and funded by St. Leo, and you guys have a very generous employer, if I must say. So they make deposits into this account every month towards the end of the month, so you won't see any payroll deductions for your HRA. And these accounts earn interest quarterly. You can use this account for yourself and anyone else covered under your medical insurance plan, again, for medical, dental, vision, and prescription out-of-pocket expenses. This account does have a unique feature in that you can vest in the HRA funds after 36 continuous months of coverage in an HRA-eligible medical plan. So after you've been enrolled in the HRA for 36 continuous months, and you leave St. Leo for whatever reason, you're able to still have access to that HRA and use those funds until the balance is gone. Dependent verification. So we just wanted to just remind you that as you're going through your enrollment, you will have to certify that all dependents for which you elected coverage are eligible for that coverage. And so now's the time, if you may have someone who you think may not be an eligible dependent, to remove them from the plan. If you remove them, their coverage will not terminate until March 31st of this year. So who is an eligible dependent? That's your legally recognized spouse, a natural child, your legally adopted child, your stepchild, a child that's required to be covered pursuant to a qualified medical support order, a child with proof of legal guardianship who resides for you, and keep in mind that guardianship does have to be through the courts, and then your foster child. And children are considered dependents until the end of the calendar year in which they turn 26. If you do have a disabled child, and that's a child who is continuously incapable of self-care, they are able to continue on the plan, but you will have to provide your employer with proof of that disability. Enrolling in your benefits. So during open enrollment period, you're free to update your benefits for April 2020 through March 2021. Your elections will remain in effect until the next plan year as stipulated by the IRS Section 125. You do have the opportunity to change your elections during the plan year within 30 days of a qualified life event. So how do you get started? You go to icubabenefits.org, you'll log in and click on Start My Enrollment at the top of the home page. You'll be asked to confirm your personal information, and we have a little legend here on the left-hand side of the screen. That'll be within your enrollment instance as well to serve as a guide throughout the process. So as you finish each section, you'll click Continue until you complete your enrollment. We do highly suggest that you email a copy of your enrollment confirmation statement to yourself as proof of your enrollment. If you need Emma, she is available. I know most will turn her off at the beginning of their enrollment, but she is always available in the left-hand corner of your screen if you need her for maybe choosing your medical plan or choosing how much to enroll in for your FSA plan. Open enrollment sweepstakes. So iCuba will be doing this sweepstakes again this year. All we ask is throughout your enrollment, you confirm your personal phone number and your personal email address. You finalize your enrollment process and you'll automatically be entered to win. Keep in mind that you actually do have to enter information. We've had people go through last year that clicked that I agree button and they had no phone number and email address. We chose them as a winner and they had to be eliminated. So just make sure that the information is there and it is correct as you're going through your enrollment. Improving access to care by eliminating barriers. That's one of our main goals here at ICUBA. We think it's very important for you all to be educated healthcare consumers, and that means understanding your plans, how they work, and how they pay for your covered services before you actually get to your doctor's office. And so we'll just be reviewing with you some of the ways that ICUBA and your representatives from your school have come up with to try to break down some of these barriers to care. The first way is through single sign-on from our ICUBA benefits portal. There's a scrolling picture banner on the home screen. Right under that section is My Carrier Accounts. Here you will have access to not only the ICUBA Benefits MasterCard, but all of the brand partner sites for the coverage in which you are enrolled in. So this section will be specifically tailored to you. If you're not enrolled in the plan, you won't see it there on your My Carrier Accounts list. But you'll click on the link. The first time you click, you may need to register and establish a username and password. But going forward, when you access the portal and click on the site, you'll automatically be logged in to these brand partner websites. And so that's one way we've tried to break down that barrier to access the care, is by making it easy for you to get to your care, your benefits, and your information. Next, another way we always try to break down barriers to care is making sure our members know what benefits are available to them at no cost, what benefits are not subject to the deductible, and those that are subject to the deductible. And so on the left, far left-hand corner, at no cost to you, we won't read them all, but there's the blue distinction total care primary visits, your EAP services, Cuba Cares, Surgery Plus, ultrasounds of the breast. These and many more things are available to all of our medical plan participants at no cost. The middle section, no deductible for advanced imaging, chiropractic services, your maternity visits, emergency room care, ambulance, emergency transportation, your physicals, prescription drugs, if you need any occupational, physical, speech therapy. All these things in that middle column are at no cost to you, so no deductible will apply. You may still have co-insurance or a copay, but these are not subject to the deductible. And then that last column, deductible does apply only to major services. So what are major services? Some are outlined here in that right-hand column: durable medical equipment, home health care, your inpatient mental health, substance abuse treatment, skilled nursing facilities, outpatient facility charges. All these major services are subject to the deductible. So as you're choosing your providers and the kind of care that you need, just keep all of these things in mind. Next is the Surgery Plus benefit. We have this is our second year with Surgery Plus. It's paired with your medical plan, so you don't have to enroll in this. Surgery Plus gives you access to an elite Surgery Plus Surgeons of Excellence Network. These are licensed, board-certified, fellowship-trained physicians surgeons who've been screened for malpractice, sanctions, and criminal records. We included just a few of the covered procedures here on the screen for you: knee, hip, shoulder, general surgery, any gastroenterology, bariatric surgery, cardiac surgery. These are just some of the covered procedures. And so why would you go to Surgery Plus versus going through your Blue Cross and Blue Shield medical insurance? Well, there's a financial incentive for you. Your deductible and co-insurance are waived. So your procedure is at no cost to you. We even have a travel benefit included with that. So if you have to travel by car or perhaps fly to that surgeon, all of that is covered for you. They have full service concierge, so you have access to a dedicated care advocate who will be there throughout your entire Surgery Plus journey. They can help you locate physicians fitting your situation. They can help you schedule appointments. They help transfer your medical records from your old doctor to your Surgery Plus doctor, and they can even help you with any follow-up visits and follow-up care and scheduling, things like that. So keep Surgery Plus in mind. I know a lot of people put surgeries off because maybe it's too expensive or they can't afford it right now. So Surgery Plus has a new great benefit that's out there for you, and we hope that this will allow you to get things that you've been put off addressed and break down that barrier to care for you. Next, it will be in Tenet Doc. Again, Tenet Doc is only a $5 copay. We do have single sign-on to Tenet Doc through the Blue Cross and Blue Shield My Health Toolkit. This is for your telemedicine and video consultations with your doctor. When maybe you can't get into your primary, you just don't have the time to take off, you're on vacation or you're on a business trip. Think of Tenet Doc as a great alternative to maybe going to an emergency room or an urgent care. You do have to establish an account prior to seeking treatment, so you'll have to register for Tenet Doc. When you're doing so, you'll have to put in a company key that will be iCuba. And then we put just some top diagnoses here on the screen for why people may be contacting Surgery Plus for sinus problems, ear infections, maybe you have nasal congestion or cough or flu or UTI. Before you go to an urgent care, try to think of Tenet Doc as a great alternative. They do not prescribe any controlled substances, psychiatric or lifestyle drugs, so you will want to keep a relationship with your primary care doctor for those things. But as far as your urgent care and emergency room benefits, please remember that Tenet Doc is a great alternative. Do you have side effects from a new medication, or you were denied at a pharmacy because you didn't have a prior authorization and you've misplaced that letter Optum sent you? Or were you told that you need to try step therapy before you take a certain drug? Or you just want to learn how you can save money on your prescriptions? These are all great reasons to call Cuba Cares. The number's there on the screen for you. It's also on the back of your Optum RX prescription insurance card. They're available Monday through Friday from 9 a.m. to 5 p.m. The people there at Cuba Cares, these are real pharmacists. They will really advocate in your behalf and offer you real solutions to your prescription needs. So if you're having any issues or you just want to get a prescription medication checkup, please consider Cuba Cares. Next, we just wanted to review the Able To program that's offered to us through Aetna. And so this is a program that allows you to meet with a therapist and a behavioral coach. You can meet with them over the phone or through video conferencing. You meet with both the therapist and the coach once per week. There's over a period of time of 8 weeks, so that's 16 sessions. And so what these folks do is really try to help you identify your health goals, help you develop an action plan, and they really give you practical things that you can do to help reach your goals. It's not only for those who may have one of the health or life conditions outlined here on the screen. If you're maybe a caregiver to someone who has one of these conditions, please consider this Able To program. I myself personally went through this program, and a year and a half later, I am still using a lot of the things I learned from that therapist and behavior coach. Health management and care consultants, these are trained health advisors and registered nurses who may be calling you from time to time to provide you with tools, education, and to help advocate for you and help you manage your chronic health conditions. I know we all hate answering the phone for numbers we don't know, but you may receive a call from care consultants from Blue Cross, Optum, Cuba Cares, or Aetna. If you get a call, just give them 5 minutes of your time. They are calling because they care. You've been identified as having one of these conditions, that they can assist you with referrals, transition to care. If you maybe have a gap in care or you don't understand the condition or the treatment plan that your doctor is recommending, these health managers and health care consultants can really assist you in help managing these conditions. So again, if they call, if you don't answer and they leave a voicemail, give them a call back and just give them 5 minutes of your time. We found that the people who really engage with these care consultants and health managers not only have better outcomes on their health, but they're actually saving money because they're not going to the doctors or emergency room or urgent cares as often by managing those conditions. And then we wanted to remind you that your doctor's primary care visits to Blue Distinction Total Care providers are always free. This is for your family practice, internal medicine, and pediatricians. If you're out and looking for a provider or you're looking for a new provider, when you're on that Blue Cross and Blue Shield website, make sure you're looking for that Blue Distinction Total Care logo on the doctor's profile. We also have Care Connected. This is a dedicated customer service team there at Blue Cross and Blue Shield. They've been specifically trained only on the ICUBA benefits. And now those customer service folks can help you with your claims questions. They can reprocess claims if they find an error. They can assist you with any billing issues you have with your doctor's office. They can help you locate a BDTC provider. They can also put you in contact with any lifestyle coaches or those coaches who can help you manage your chronic conditions. You don't need a separate phone number. It's the same number that's already on the back of your Blue Cross and Blue Shield ID card. Next is the Blue Cross and Blue Shield My Health Toolkit mobile app. This was new last plan year, but we just want to remind you that it's out there and it's available and some of the great features of the app. So you can log in with that same username and password you established with your single sign-on from the ICUBA portal. You have the opportunity in this first picture here, you can save your ID card. I really like this. You can save your ID card to your home screen. So if you're in your doctor's office and you're somewhere and you need that card, you don't have to log into the app. You just click on View ID Card and it'll pop up there for you. You can also say if your child or your husband or your wife is at the doctor and they've forgotten their card, you can come to this app and just send them electronically a copy of the ID card. It does have Touch ID and facial recognition login capabilities. And so this app gives you access to your benefits, your claims, your EOBs, all at the touch of a finger. If you haven't already, this is one app that I really, really recommend you download. Employee Assistance Program is brought to us through our partnership with Aetna Resources for Living. This is for all active employees, so you don't have to be enrolled in a medical plan to have access to the EAP benefits. They can help you with emotional, life, legal, and financial issues. So for your emotional, you can speak with a licensed clinician. You get 6 sessions per issue per year, and this is available to you and each member of your household. They can also help you with life issues if you need a referral for a dentist, a daycare provider, someone to cut your lawn. They can give you a list of recommended services providers. They also have some great discounts on the EAP Resources for Living website that they can get you in touch with. I personally use the fitness discount through LA Fitness from Aetna. They also have some great legal experts that can help you with your wills. Maybe you're thinking about renting out a house or a room. They can come up with some templates for some good legal documents for you. They also have financial consultants who can help you with budgeting, retirement planning, college planning. It's tax time, so you may have some tax questions. If you do, think about EAP resources before you pay that extra money to H&R Block as you're going through with your taxes. Their number is right here on the bottom of the screen. It'll be the same number that's here. You'll press option 1 for your EAP benefits, and just keep in mind that anything you say to the EAP providers is all free and confidential. So none of what you say will be coming back to your employer. Next, EAP Goes Digital with Talkspace. We know a lot of people now use their phones for texting more than they are for talking. So you can now, through this online platform, talk, text, send pictures, video, audio to a licensed therapist via a web or mobile browser. On average, 1 week of Talkspace messaging is 1 EAP session, and you get 6 free sessions per issue per year. So you can talk and text with that therapist 5 days a week during their business hours. We have some information on here. You do need to give Resources for Living a call for authorization, and once that's done, you can just register. You'll be given an option of a few therapists. You choose your therapist and begin your communications. Keep in mind also that this is only available to adults over the age of 18 right now. So if you have children, they will need to use those more common ways of contacting a therapist. Another way we try to break down barriers to care is with various mobile apps. And we have a plethora for most of our blend partners, and even one of my favorite is the MyQuest app. And so These are always available to you for most of our brand partner apps. You'll get some of the same great benefits and features that you do with that Blue Cross app. So if you don't have these already, consider downloading these so you have your ID cards, your benefits, access to some new providers right at your fingertips. And then great news, the same benefits for the brand partners that you see on the screen will be continuing into the next plan year. We'll talk about some of the medical plan highlights first. Keep in mind that what we're reviewing here is for in-network benefits only. And this is just a little highlights to compare all of the 3 plans that you have this year. There's the preferred PPO, the premier copay there, and then new, we really want to get into the 4,000, 8,000 plan. Again, this plan is for healthy families with children. You can see the deductible and out-of-pocket maximum on the 4,000, 8,000 plan is significantly higher than your preferred and premier plans, and that's highlighted in blue here on the screen. In that middle section in white, you'll see for the preferred PPO, there's a 20% co-insurance on your office and specialist visits, urgent care, there's a copay there, your emergency room. On the middle column, you'll see all of your responsibilities, your out-of-pocket responsibilities when you're going to your various doctor's visits and emergency rooms. And the far right, there's that deductible PPO. As you'll see for the preferred and the premier, the main difference in those plans are how you choose to pay. Are you someone that wants to know what you're responsible for so you can budget and plan and know up front? The premier copay just has a copay structure, so you'll know up front what your responsibility is. The preferred PPO, most people are familiar with that. That's the 20% co-insurance. And then this new plan, the 4,000, 8,000 plan, as you'll see, that has a copay structure as well. The main difference in the preferred and the premier is that these amounts are a lot higher. And then the bottom section there in gray, these are the things that have the same out-of-pocket cost to you no matter what plan you're on, your Blue Distinction Total Care, Teledoc, your convenient care, your preventative services, and then your outpatient diagnostic services. No matter what plan you're choosing, all of these benefits will be the same. The prescription drug plan through Optum is remaining the same as well. One thing we did want to highlight is the 90-day at retail or mail will save you more. So with the 90-day prescription fill, you're getting 3 prescriptions for the cost of 2. So if you're someone who's filling the same medications month after month, you may want to talk to your doctor and consider switching to the 90-day to save yourself some money. We also wanted to highlight some prescription drug freebies that are available to you for your diabetic supplies, including meters, lancing devices, your Lancet, test strips, control solution, needle syringes. All of these are free with your prescription drug insurance. Also prescribed aspirin for adults, generic folic acid, prenatal vitamins, and then some prescribed generic statins. These are all prescription freebies. So if you are taking some of these, when you get your prescription or your over-the-counter item, and you take that to the pharmacist along with your Optum ID card. And then lastly, under prescription, we just wanted to remind you that there is an out-of-pocket maximum on the prescription drug plan as well. If you're someone who's taking a lot of prescriptions and you're not going to the doctor that often, we do have some income protection for you by way of that out-of-pocket prescription maximum. Next is the Aetna Behavioral Health and Substance Abuse Benefits. This again is paired with your medical plan. You have access to professional counseling, psychiatric medication evaluation, applied behavioral analysis therapy for those autism benefits, and then some intensive services for hospitalization, detox, and residential treatment. It's the same number as you'll use for your EAP benefits. Option 1 again is for EAP, and option 2 will be for behavioral health. Here on the screen are your monthly medical plan premiums, including that generous HRA that St. Leo has provided for you. Next is your Humana dental benefits. You have 3 plan offerings this year: the high PPO, the preventative low PPO, and the DHMO prepaid benefit. Again, these are the same benefits offerings that you currently have. Nothing is changing here. We did just want to highlight that on the DHMO, this network is only available in Florida. So for those of you who may have children out of state going to college, if you choose this plan, just know that benefits are only available in Florida. Even if there is an emergency, your children won't have coverage if that's the case and they're out of state. They'll have to come back home to seek treatment. The only other important thing we want to mention is that on that preventative plan there in the middle, there is no major services available and no orthodontic treatment under that Preventative Plus plan. So just keep that in mind as you're considering your elections for next year. And here are your Humana dental premiums of the upcoming plan year. There is no change to this premium. Next is your iMed Vision plans. There's a base and a buy-up option available to you. We wanted to highlight some of the differences on the plan. With the base plan, you can get frames every 24 months. Buy-up, you can get them every 12 months. And then the only other differences come on your frames and contact lens allowance. Under the base plan, there's a $100 allowance, and under the buy-up plan, there's a $130 allowance. And here are your vision plan premiums. Again, there is no change in your vision plan cost. Next, we just wanted to remind you of the income protection benefits that St. Cecilia offers to you. There's basic life and basic AD&D, voluntary life, voluntary AD&D, spouse life, child life, short-term disability, and long-term disability. So as you're going through your open enrollment instance, just keep a lookout for these benefits. And keep in mind also that age restrictions and enrollment limitations will apply. And again, on life and disability, we just wanted to review EOI. So during open enrollment, you may have the opportunity to increase your life and disability coverage. So evidence of insurability may be required if you go above that guaranteed issue amount. If you do, you'll see this little box pop up on your screen that says, hi, action is required, evidence of insurability. This EOI process must be completed directly following your enrollment. You'll complete enrollment, and on your confirmation screen, that Symetra box will pop up to take you out to the Symetra site where you'll complete that health questionnaire. Keep in mind, we are aware that you may not have, especially for your spouse, all of the answers to the questions. Just please do your best to answer the questions to the best of your ability, because this will be your only time to complete this process. And if anything else is needed, Symetra will contact you to get that information. But again, just do your best to complete EOI when you've completed your enrollment. And then just some open enrollment housekeeping. By way of review, changes made during open enrollment are irrevocable for the benefit plan year as stipulated by IRS Section 125. Changes made outside of open enrollment are only permitted within 30 days of a qualified life event. And then your 1095 tax forms are available at icubabenefits.org in your employee file. This is not required to file your taxes this year. So with that in mind, if you don't need that form, it'll always be available on the portal for you. And then all requirements of healthcare reform are in place here at iCuba. In fact, the iCuba plans offer more generous free wellness benefits than we are required to by law. And then with this open enrollment time, this may be the time that you may want to review or update your life insurance beneficiary information. If you have children that are under the age of 18, just keep in mind also that you may want to contact an estate planner, establish a proxy or a trust so that your children are protected as well. And then we also wanted to lastly just review some additional benefits that are available to you all as employees of St. Leo. It's your AIG retirement benefits. We'll talk about Berkshire Hathaway, your gym and fitness center discounts, as well as tuition remission and tickets at work. First up is your AIG benefits. So St. Leo, through AIG, formerly from VALIC, offers all faculty and staff of St. Leo the ability to contribute into a 403B account. However, only regular full-time employees will receive that match. The plan contains no waiting period for matching funds as shown here on the screen. If you want to change your contribution amount or your beneficiaries, or you just need more information, you can contact this email address here on the screen. It's wellness.benefits@stleo.org. If you're not sure where to go online, you can go to St. Leo's intranet page, Human Resources, and then Retirement Program. Next is Berkshire Hathaway Home Services. So St. Leo through Berkshire Hathaway offers at no cost to employees to participate in this program. All employees are eligible to receive a cash rebate as displayed here on the screen on a home sale and or purchase when you participate in this program with Berkshire. So all St. Leo employees and their immediate family members are eligible to receive cash savings on the purchase of a home sale or real estate. If you're interested, or if you just want some more information, there's some contact information here on the screen. You'll contact Melanie Brush at the phone number that's listed there. Next is your fitness perks are available to you. You can join the YMCA, and that joining fee is waived. As an employee of St. Leo, you'll also receive a 10% saving on your monthly membership fee at any Tampa Bay YMCA location. And for those of you who work on the main St. Leo campus, you don't have time to maybe get to a gym, as an employee of St. Leo, you and your immediate family members have the benefit of free membership to the 4,000 square foot fitness center located adjacent to the Marion Bowman Activity Center. Next, we will review your tuition remission benefit. St. Leo provides tuition remission benefits to all employees, their spouses, and dependents. As shown here on the screen, full and part-time employees who have completed at least 90 days of service, and spouses and dependents of full-time employees who have completed at least 1 year of continuous employment with St. Leo prior to the start date of classes are eligible to participate in the tuition remission benefit. For more information, please contact your St. Leo Human Resources business partner. And then lastly, Tickets at Work. St. Leo through Ticket at Work offers discounts and special access to theme parks and attractions to all employees and their immediate families. You just log into ticketatworks.com using the St. Leo company code, which is St. Leo, and you'll learn more and get access to some of those great benefits. That brings us to the end of the presentation. We want to thank everybody for participating in this webinar. We're so excited about our upcoming 18th year of service to not only all the employees at St. Leo, but all of ICUBA's 27 member schools.